Okay, and I'm gonna turn it on and we will get started. Oh yeah, Anthony, you have to decide which team gets to start before I turn it on.
Thank you for that. So I have 3 numbers in my mind, and 1, 2, and 3. It's going to be one of those numbers. I'm looking on my Hollywood Squares. UCLA is first pick, Balboa is second, and UCR is third. I have a number. Please pick which number you want, UCLA.
2, please.
All right. I have 2 for UCLA. Balboa?
1.
And UCR? 3. So the number was 3. So we'll go 3, 1, 2. So UCR gets the board to start.
Okay, so here we go. All right, UCR, you have the board.
IC, it's IC for 100.
IC is IC for 100. Spontaneous coronary artery dissection occurs most commonly in this coronary artery.
UCLA.
What is the left anterior descending?
That is correct. UCLA, what color would you like? Yellow or what? Yeah.
Sure, yellow is fine.
Okay, and since we added Balboa, I will make you blue. Yo, you guys are very blue right there. Blue, is that okay? So yeah. Blue here, good yellow, yeah. And then Riverside will keep you salmon. Okay. Nice. All right, here we go. So what is the LED? LED is most common. 32 to 46%. Circumflex is second. RCA is last, and then left main least common. Okay, UCLA, you have the board.
Go ahead. Whatever you want. I see it's IC for 200.
I see it's IC for 200. IV Cangalore is being infused in a patient with a STEMI. To ensure absorption, only this approved antiplatelet can be given while Cangalore is being infused.
UCLA.
What is ticagrelor?
That is correct. Okay, UCLA.
Okay.
Yeah.
Oh, sorry. Can we do IC? It's IC for 300.
I see it's IC for 300. Okay, this is the daily double. What is your wager? You have the option of wagering either up to $300 for what you have in bank, or 400, which is what's a maximum on the board. Minimum is 100, and you must answer the question.
Right. So if we do the minimum of 100 and we get this right, we get 400 extra. Is that correct?
No, you just get 100 extra.
Oh, you just get 100. Oh, I see. 200.
200. All right. Okay, here we go. In the appropriate use criteria for PCI in 3-vessel disease, what syntax score is used to define low disease complexity? And make sure, since that this is not open to other teams, make sure to state specifically whether it's less than or less than equal to.
Oh.
I'm turning on the sound timer.
What is less than equal to 22?
Yes, that is correct. Yeah, you guys just shaved it in under. You started speaking slow. That was very smart. Yes, what is less than equal to 22? The good way to remember this is it's low is less than equal to 22, high is less than equal to 33. So it's multiples of 11, 2 repeating numbers, and then the zone is intermediate. The funny part is if you Google it, the first Google answer that comes up from a Morton Kern article is actually not correct, or at least based on something else. It's very interesting. All right. Did I give them the score?
No, you didn't.
Okay, I'm pressing now. It's 500. Okay, so that's correct. Math is correct. We're moving back to the board. All right, UCLA.
We'll do drugs 100, please.
Okay, a 78-year-old female presides outside hospital with chest pain and 2 mm ST elevation. She's 4 hours away from nearest PCI center. The decision was made to give the patient fibrinolytic therapy and transfer to nearest center. The patient is given aspirin 81. This is the dose and the additional antiplatelet therapy indicated.
UCLA.
What is clopidogrel 75 milligrams?
That is correct. Okay, UCLA.
They have it. Supervisor real.
The same category, drugs for 200, please.
This medication is commonly prescribed for claudication symptoms. However, should not be used in CHF due to the inhibition of phosphodiesterase.
Balboa.
Yeah, what is Agronox?
That is incorrect.
UC Riverside.
It's
Riverside? Answer? They are lagging. Did you guys notice that?
They
Yeah,
froze and they're muted both.
Where are they?
There
When
you
they
go.
get on,
They
yeah,
froze at Quan, they froze and muted.
yeah.
Can
So
you
let-
unmute
let's-
yourself, UCR?
Okay, we will pause here for a second and let them get back on. When they get back on, despite the time, we will allow them to answer. And then if we fail. Wow,
I'm not sure what's going on here.
was it an earthquake or
No,
comet,
we are, time is
Tidal-
paused for the moment.
tsunami, tidal wave?
So there we go. Okay, the next time we go. Next time we go.
I think they exited maybe.
Yeah, they're logging back on.
I'll pause. Force majeure. The tsunami would have taken out San Diego and UCLA first.
Just come out to us. Yeah.
still here. Yeah.
Oh, dear.
Oh,
Once we buzz, we have to give an answer.
yes,
Correct.
correct. And then there's this timer bar here at the bottom. Once you buzz, I will, if some people are going quickly, but I'll turn it on and you have to answer before the end of this. I'm using this thing as a, like, you guys gotta get in there and do what you have to do.
Got it.
Got
Okay.
Right.
It was covered up on my tablet. Yeah.
Quan, I think for the time delay here, I'm uncomfortable having UCLA provide an answer, just from the time delay. So what I think is fair is we will allow UCLA the opportunity to answer a question as the other school that did not have a chance to participate in this answer. It is but what I would like us to do, Quan, in this scenario is start the timer and allow UCLA the opportunity to buzz. If they choose not to buzz, then they won't be expected to provide an answer because it's not a daily double.
Okay, Anthony, so just to be clear, are we dropping Riverside from the competition?
No, we're dropping Riverside from this question.
Okay.
I
just
think you
wanna-
meant UC Riverside when you were mentioning UCLA.
Oh, I'm so sorry. I apologize. So let me say it again. So UCR has been away long enough that I don't think it's fair to have them answer a question just in the spirit of integrity. Not that I would think there would be any reason to expect otherwise, but I would like, as UCLA, the only other school who has not had a chance to answer this question, let's start the timer and allow UCLA the option to buzz in and answer or let it pass.
Okay, I'm starting the timer now.
UCLA.
What is silostazole?
That's correct.
Just one.
All right, let's now go to the next question since UCLA is logging back in here.
UCR, yeah.
Gosh,
UCR.
dang it, guys. Sorry. I know my UC schools, honestly.
Hey, sorry about that.
Yeah,
So we are going to move forward with the next question, Rod. Are you guys feel more comfortable with your connection right now?
Yeah, we're hardwired in. I don't know what happened. So sorry about that.
It's not your, well, it's certainly not your fault. So Dr. Lee, why don't you move forward to the next question, please?
Okay, yeah. In your absence, Riverside, UCLA successfully answered the question. Pani, did I subtract? I did, right? It
Yeah,
looks like I did.
Yeah,
Yes.
you subtracted for Balboa. Yep.
Appropriately. Okay, good. All right, UCLA, you have the board.
We'll do drugs for 300, please.
This is the preferred SGLT2 inhibitor to be used in a patient with type 2 diabetes and atherosclerotic cardiovascular disease.
UC Riverside.
Gliflozin.
I'm sorry?
Empagliflozin.
Yeah. What is that? Yes. Even though the second person answered not informed the question, the first person did. I just failed to hear. The sound connection is not great. But that is correct. It's empagliflozin.
We have to answer in the form of a question. We're doing it like straight Jeopardy rules.
Yes. Yes,
Okay.
absolutely. Yes. I think everyone is familiar with Jeopardy at this point, that we are not going to accept answers not in the form of the question. So empagliflozin was shown to decrease atherosclerotic cardiovascular morbidity and mortality. This question has some subtlety to this. In the ACC, practice statement, they don't really differentiate between the four, but empagliflozin definitely has probably the stronger data of the set. Okay. Riverside, I think you have the board.
Let's do drugs 400.
Drugs 400. This is a mechanism of action in the class of drug of mavacamten, which is shown in the Explorer HCM trial to improve exercise capacity, LVOT obstruction, and NYHA functional class in symptomatic patients with obstructive hypertrophic cardiomyopathy.
UCLA.
What is inhibition of myosin and subsequent inhibition of the actin-myosin binding for muscle contraction?
Yeah, that is correct. That was Riverside, right?
No, that was
Sorry,
UCLA.
it was UCLA.
Sorry, UCLA. Okay, sorry. Yeah, all right, keeping me honest. That's correct. All right, UCLA, you have the board.
Old school hemos for 100, please.
The hemodynamic effects of milrinone include the following: increased cardiac output, increased heart rate, and this effect on systemic vascular resistance.
UCLA.
What is decreased?
Yeah, that's correct. All right, UCLA.
Hemos for 200.
Hemos for 200. Distinguishing between severe aortic stenosis and hypertrophic obstructive cardiomyopathy, this is the invasive sign seen on simultaneous LV and AO pressure post-PVC.
UCLA.
What is Brockenborough, Braunwald-Morrow?
Yeah, that's correct. Yeah, this question is a darling of Jeopardy and boards, etc. So I'm not going to get into this. UCLA?
Hemos for 300.
Hemos for 300. All right, I'm going to read very slowly. A 22-year-old female with hypoxia was brought to the cath lab for a right heart cath and shunt study. We know her QP-QS ratio is this value. I'm going to turn on the timer.
UC Riverside.
1.1.
Okay, that's not acceptable. You have to phrase it A in the form of a question, and the answer is incorrect. Okay, I'm turning the timer on to allow the other teams to have options.
What is
Balboa.
1.1?
I'm sorry, you dropped out for a second. Is that 1.1? Is that what you said?
What is?
That's incorrect. Okay, timer is on for UCLA, the option to buzz in at which point Okay, so the most important thing about this equation here is, you have to, because clearly, the step up is, here, right? So you have to apply the equation that equalizes SVC and IVC and converts that, right? So you got 3 SVC plus IVC divided by 4, okay, which is 70, 78, okay? And then obviously the equation is here, right? FA set minus mixed venous set, right? Which is this number divided by PV set minus PA set. And the numbers were set up so that you would get a 2.0, okay? That's a tough one to do under duress. Kudos to you guys who tried. All right. So who has the board? The same people, right, as before?
Yeah, I think it's UCLA.
Okay, UCLA.
We'll do hemos for 400, please.
Yep. The pulmonary artery pulsatility index (PAPI) can be used to evaluate RV failure in cardiogenic shock. This is the equation used. Turning the timer on.
Balboa.
What is pulmonary artery systolic pressure minus pulmonary artery diastolic pressure divided by central venous pressure?
That is correct.
Let's do something different.
All right, Balboa.
We'll do living with HIV
For
100.
100. Okay. This risk factor for development of heart disease is noted in half of patients over the age of 50 taking antiretroviral therapy.
UC Riverside.
Is hyperlipidemia?
That is incorrect. Turning the timer back on. Okay. The answer according to the nationals is what is hypertension, although to be honest with you, Riverside, when I first saw that question, I had the same response. So okay.
And living with HIV for 200.
Living with HIV for 200. A 45-year-old patient with HIV on ART has a prominent diastolic murmur on exam. The disease process shown is characterized by the occlusion of this layer, okay, this layer of the structure in the images. I'm putting the timer on.
Balboa.
What is the intima? Of the
Close.
aorta?
Yeah, close, but not quite. Turning the timer back on. Yeah, so the answer given by the nationals was the vasal vasorum. You were very close, but yeah,
Okay.
tough one.
Try something different. What do you guys want to do?
Okay,
Yeah, CV smorgasbord 400.
400.
Let's do it. We need points. We need points, guys.
400. Okay. This echocardiography scoring system is used to determine the likelihood of a successful balloon valvotomy in mitral stenosis.
UCLA.
What is the Wilkins score?
That's correct. What is the Wilkins score?
Juan, we have 2 more questions in single Jeopardy before we move to double Jeopardy in the spirit of time.
Okay, we'll do. I'm going to jump. Everyone's familiar with the Wilkins score. Okay, next up.
CV smorgasbord for 200.
This Agatston score can be used to define severe aortic stenosis in patients with low flow, low grade, and severe AS with normal LV function. So before I continue, either women or men score is fine by me, okay? Values for women and men are different.
UCLA.
What is 2000 is one of them, 1200 is the other.
Okay, I will accept that. Anthony, you good?
1223.
Yes.
2000s are answered.
Yeah, okay, 2000 for men and you know, this one is a bit interesting, but well, nationals decided this. All right. UCLA.
Maybe smorgasbord for yeah, we'll do smorgasbord for 100.
Okay, this is the last question in single before we jump to double. 70-year-old female with colon cancer, coronary artery disease, hypertension, AFib, presents with hypotension and septic shock during hospital stay, found to have this EKG, very pathognomonic. Please discontinue this medication. She has been at her home and her kidney function is getting worse. Go.
UCLA.
What is digoxin?
That's correct. Yeah, that's a classic EKG. It's this fast one to talk about, but in the interest of time, I'm going to jump.
Thank you.
All right,
we did double.
Okay, we're going to double.
I would say would be.
We do, okay.
Yeah.
Okay, UCLA.
Cards 101 for 200.
Cards 1-1 for 200. Thiazide diuretics can result in what abnormality in the lipid panel?
UC Riverside.
Hyperlipidemia. What is hyperlipidemia?
No, that is incorrect. This is a specific abnormality of a lipid panel. Hyperlipidemia is just high cholesterol.
Balboa.
Balboa, I'm turning the timer on.
What is hypertriglyceridemia?
Yes, correct. Yep, you got in just in time. What is hypertriglyceridemia is correct. Okay, Balboa.
Whatever you want.
What is rhythms gonna get you?
Rhythm's gonna get you for 200.
Oh yeah, well, yeah.
Okay, this is the daily double. Your wager, please. You have okay, you can wager up to 800.
Okay.
Let's
Yeah.
do it all.
800.
Okay, living on the edge. There we go. Have to answer, okay?
Yeah.
Shot.
Which class of sorry, turn it off. Which class of antiarrhythmics are contraindicated to suppress asymptomatic ventricular arrhythmias after acute MI? Contraindicated. Okay. Yeah, the time's up. Sorry, guys.
Oh,
Oh man.
that was fast.
Yeah.
It's class 1C. Remember this? Class 1C antiarrhythmics, anconite and flecainide to suppress asymptomatic, increased rate of death, right? Famous
Yeah.
from. Okay, who has the board?
I thought it was like off. I thought we, okay.
Balboa has the board.
Balboa has the board.
Who's gonna get you for 400?
400.
Sure.
Atrial fibrillation incidence doubles with this demographic variable in the population per 10 units. I'm going to add that, editorialize.
UC Riverside.
It's if you are older than 75 years old.
Anthony, what do you think of that answer?
I need it in a question.
Yeah. And also,
It's not specific.
okay, not specific. All right, that's wrong then. We're going to go wrong.
Balboa.
Opening, Balboa.
What is,
Balboa.
Sorry?
what is age?
That's correct. What is age is correct.
All right, we said what is older than 75. We were too specific.
Yeah, that's what I was trying to get at, Anthony. Yeah, that's why I used the term per 10 unit variable. So greater than 75 is not quite the same as that, age is correct. Yeah.
Okay,
Yeah, this is a little nitpicky, I'm sorry, but
that's okay.
We got on this.
All right. Balboa,
Well, a picture's worth 200.
pictures worth 200.
Oh, yeah.
35-year-old Asian man presented with dizziness, presyncope, and murmur. An echocardiogram was performed, which shows this abnormality. This is a still picture.
UC Riverside.
What is a myxoma?
That is correct. What is an atrial myxoma? Okay. Good. Riverside.
Rhythm's gonna get you 600.
Okay. Unlike other class 3 agents, this antiarrhythmic agent increases the defibrillation threshold of AICDs.
UC Riverside.
What is amiodarone?
That's correct. Okay. That's another favorite question of boards, etc. Riverside.
Same for 800, please.
This genetic mutation of LQT1 syndrome predisposes patients to the following rhythm. So I need not just the channel, but the whether it's gain or loss of function.
UCLA.
UCLA?
Sorry, can you hear us?
Try again. You ran out of time, but I give you one chance. Answer the question.
So sorry, we were on mute. So what is a loss of function of the sodium channel? And the rhythm is Torsade de Pont.
Yeah, that is incorrect.
Riverside. UC Riverside.
What is loss of function of a potassium channel?
Anthony, are you okay with that, or do you want them to be more specific about the channel?
I am fine with that answer.
Okay. Yeah, it's the KCNQ1 potassium channel gene. Okay. That was a tough one. Well done. Riverside?
Let's do a picture's worth for 400, please.
Pictures worth 400. A 70-year-old had repair of traumatic pelvic fracture, then became hypotensive with AFib and RVR. She was shocked but did not convert. On transfer to ICU, she required vasopressors and was intubated. Echo was obtained suggestive of what cause of her acute illness.
UC Riverside.
This pulmonary embolism.
That is Anthony. We talked about this earlier. Are you okay?
Yeah, we'll accept that answer.
Yeah.
This massive pulmonary embolism.
Yeah, no. Fat, but honestly, it could well just have been a PE as well. So I think myself and Anthony talked about this before, and we agreed to do this.
Yeah, we actually committed to either one of those answers being acceptable, because in either scenario, a patient could have a pulmonary embolism or a fat embolism. So,
okay, given how close this is, we're going to go fast. Okay, Riverside.
Let's see cards 101 for 400, please.
These are the 4 components of metabolic syndrome. We need all 4.
The Riverside.
What is obesity, diabetes, hypertension, and
where's the conference?
No, that's not correct. That's not specific enough and not quite correct. I'm turning the timer on.
No one else
Okay.
buzzed in.
Yeah, so it's elevated fasting serum glucose, not just diabetes, right? Elevated serum triglycerides, specifically abdominal obesity, not just obesity, and hypertension. Okay, I think Riverside still has the board, right? Nobody else.
Let's do different strokes for 200, please.
This cardiac space is a derivative of the atrial primordium. In adults, it can have many different types of structures. It arises as an extension of the embryological pulmonary vein bud.
UCLA.
What is the left atrial appendage?
That's correct.
I mean, if you knew it,
yeah, I was not 100%.
All right, UCLA.
I didn't want to go back in negative.
Can we do pump you up for 200, please?
You up for 200. The gold standard for diagnosing myocarditis is
UCLA.
What is endomyocardial biopsy?
That's correct. UCLA, the board.
Pump you up for 400.
My hands are sweating, by the way. In the first 8 weeks of initiation of this heart failure medication, NT-proBNP is the preferred measured cardiac biomarker and not BNP.
UCLA.
What is sacubitril valsartan?
That is correct. Yeah, that's a very interesting little tidbit. UCLA?
Pump you up for 600, please.
Pump you up for 600. An 85-year-old man with shortness of breath has normal EF and the tissue Doppler shown below. The most likely diagnosis is?
UC Riverside.
What is a heart failure with preserved ejection fraction?
Anthony, not specific enough. Sorry.
Balboa.
What is cardiac MO?
That's correct. Yeah, yeah, you need it to be more specific, not just, you know, diastolic heart failure.
Juan, we have three. I extended it by 3 minutes, and so for the log answer, we have 3 more questions left now.
Okay, 3 questions.
What
Did
is?
did I give the score up there? Sorry, did I give the money?
Yeah,
We got our good.
Okay.
Yes, yeah.
Okay, go.
Pump you up 800.
Pump you up for 800. Neutropenia, muscle weakness, and the echo findings below are consistent with this syndrome.
UCLA.
What is Barth syndrome?
That's correct. Well done. I never heard of this until I saw this question. Genetic condition, males, low blood cell count, weakness of muscles, fatigue, compaction.
Different strokes 400, please.
We're still in place, please.
A 64-year-old woman presents with right hemi anesthesia. Her bedside TE done for a soft diastolic murmur shows the image pictured. This characteristic, all right, the specific question is, this characteristic of this finding would indicate a favorable risk benefit for surgery. Turning the timer on. Yeah, that's wise. I think this is a weird one. I'm jumping to show you the answer quickly. What are highly mobile or large tumors greater than 1 centimeter? That was the specific characteristic. Okay, go ahead. Last question, I think, right, Anthony?
Sure, we better be sure.
Last question, choose.
Pick a big one.
Sorry, is it our?
It's UCLA's.
Yeah, UCLA.
Question.
Sorry. Yeah, you still UCLA.
We'll do a pictures worth for 800.
Picture 800. A 65-year-old man with multivessel CAD had CTO intervention of the left circumflex. This is not a video, by the way. During PCI, he became hypotensive. Repeat contrast injection of the circumflex is shown, followed by echo, including contrast microbubble injection into the circ. This is what happened. What is the finding?
Balboa.
Just the finding in the echo or the finding in the angiogram?
Okay. Let's go for finding in echo. This is the first picture. This is the second picture. This is the third picture.
Yeah, or coronary cameral fistula.
Sorry, Nick, Balboa.
What is-
That should have been in the form of a question. I'm sorry, but at this critical phase, I can't allow that. I'm sorry. You agree, Anthony?
I think, and it was a really good attempt, but it was an incomplete answer anyway.
Yeah. Okay.
UCLA then.
All right. I'm turning it on.
UCLA.
Oh, what is perforation of the circumflex resulting in a fistulous connection between the circumflex and the left ventricle?
Yeah, that is correct. That is a very detailed, correct answer.
There's boys, but we're having fun. That's
Okay. We're going back to the board. Okay, we are reaching the end. We are going to jump to final Jeopardy. Okay. Hold on a second. Okay, final Jeopardy. Okay, the topic is going to be ECG. All right.
anything.
Yeah. I think Balboa can't wager, right? Being negative. So
I still want them to participate, though.
yeah, sure.
Sure. Happy to be
So,
here.
Riverside, write your wager down on a piece of paper. UCLA, write the wager down. Show us your piece of paper. Don't show us the amount, but show us a piece of paper.
Balboa, you can submit cryptocurrency.
Okay,
Cool.
don't show us yet. Okay, yeah. My account number is 1234.
One Bitcoin. They're cheap.
Okay, good. No, where's the? Huh. Okay, I'm gonna move across. Okay. An intervention was performed for an acute diagnosis in this 31-year-old man with chest pain, nausea, and vomiting. An ECG admission on the left, and after 4 hours is shown on the right. He was treated for this problem. The question is, what was the problem? Okay, I'm gonna turn the timer on. Write your answer down, please.
Where's Liana's music?
Yeah. Okay, I'm singing along. Do, 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 do. Yeah, the weird thing is I can hear the music, but you
I
can't.
can't.
All right, are you ready to write the answer down? EKG on the left is initial, right is after. All right, we need to finish up. Please decide. I'm gonna count to 10. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay. Please show us your. The answer was hyperkalemia. Okay. Yeah.
I can't. Your writing's too small, so I'm gonna have you guys read it. We're upper 40s here.
Not correct.
So Balboa, what did you write down?
We just saw it as Brugada syndrome.
Okay. UCR.
Yeah, we had an LAD STEMI.
And what was your wager?
$2.99.
Okay. And UCLA?
We said the same thing. We said an anterior STEMI.
And what was your wager?
We wagered $100.
Okay.
Okay.
All right. Well done, guys. That was very close. There were some great, surges and etc. during the competition. Anthony, do you want to announce the winners for this round?
Yeah, sure. And we finished just when my timer went off. That was perfect. So, thank you to everyone for joining us today. UCLA, congratulations on a game well played. I think all of us need to remember at 3 a.m. when a STEMI pager goes off, it could be something other than a STEMI. So hopefully that may be the most important take home for our practices as we move forward. UCLA, you will be joining Stanford from the north on February 12th. And may the best team win and represent the state of California in a fantastic way. But again, I'm so thrilled and proud of all of our fellows today, both on the north and the south. I think California is awesome, and in large part due to our fellows in training. So thanks again for your time. We really appreciate it. And Quan, thank you so much on behalf of California, being willing to join us today from Arizona.
Yeah, thank you for the privilege. I think this was a lot of fun, and it was great to see the teams, and I'm really impressed by the performance.
And dare I say next year, maybe we will hopefully be able to do this in person at some point in time. So, but anyway, again, enjoy the rest of your day. And I think with that, we'll exit the Zoom.
All right. Thank you.
Thank you.